So Andrew, are there any other methods at the moment of diagnosing celiac disease, or is it just biopsy?
So traditionally, the way to diagnose celiac disease has been looking in somebody who might have symptoms or be thinking that they could have celiac disease, doing some blood tests that point in the right direction, and then moving ahead to an endoscopy and looking at the surface of the bowel for the confirmation. And largely that is still certainly a diagnostic approach, a journey that we take very often. But over the last years, beginning in Europe with some guidelines, there's now what we can call a serology-based or no biopsy-based approach to considering the diagnosis of celiac disease. And so in a child that presents with symptoms, that has abnormal or high antibody levels on their blood tests, we can consider making a diagnosis without a biopsy when there's more than one antibody test. So I would do that at a second time, so that's not just a lab error, so that it's real. And the level of the antibody needs to be a certain amount, so 10 times what the normal range is. And so in that context, in somebody with symptoms, their initial blood test looks very much pointing towards celiac disease and the height of their antibody test is sufficient, then I would often have a discussion and suggest, let's consider this approach, we'll do a second blood test, and if that all matches, then we move ahead with the diagnosis of celiac disease without a biopsy.
Right. Do they still have to be eating gluten to be able to get those diagnoses?
Absolutely, yes, that's really important. So whenever we're thinking in terms of making a diagnosis of celiac disease, it's really important that that person continues to have gluten in their diet until the diagnosis is confirmed, whether that's with a biopsy or whether that's with serology, with the antibodies. Taking away the gluten too soon can compromise those steps, can modify the antibodies or the biopsy and make things into a grey zone that we want to avoid. So we're still making a decision that is a lifetime decision, and it's really important to get the right information to help make that decision right at the beginning. So Tom, your mum was just mentioning that a number of people in her family also have celiac disease. And obviously you do as well.
Yes.
So we talked earlier in terms of genes being important in terms of why some people get celiac disease and some people don't. But if we looked across Christchurch, we'd probably find half of Christchurch, or maybe even 2/3 of people in Christchurch have one or other of those genes. So lots of people have the genes, but that doesn't mean that they'll ever go on to get celiac disease. And it's probably more like 1.5%, at least 1%, probably even more than 1% of people in Christchurch do have celiac disease. So lots of people that don't have the gene, that do have the gene, don't ever get celiac disease.
So what are the chances that the rest of our family will get celiac disease or have the gene?
Within a family, usually the risk is somewhere like 10% with a first degree family member, so a sibling of someone with celiac disease.
What about a twin?
So when it's a non-identical twin, it's probably about 30%, and with an identical twin, it's something like 70%.
That they'll have the gene, or that they'll get celiac disease?
They will get celiac disease.
Right.
As well.
The chances, do you know what the percentage is that they have the gene? Will everyone in my family have the gene? Will all of my children have the celiac gene?
Not necessarily, no.
Okay. But the chances are higher of having the gene probably than if I didn't have celiac disease.
Oh, sorry.
I'm getting myself confused. So I had heard that so I've got 4 children. I have celiac disease and obviously have the gene. My children all have the gene. We've tested them all and they all have the gene. Because I've actually got celiac disease and they've got the gene, does that make it is there a higher chance that they will get celiac disease because I've got celiac disease, regardless of the gene situation?
I don't think so, no.
Okay, so the switching on of the celiac disease gene doesn't necessarily mean it'll switch on in my children any more than it would if they had a mother without celiac
Because there's
disease.
other factors, bugs or other environmental factors or changes that can trigger the onset of those changes.
Yeah, right.
So some people will have a higher risk of developing those changes, but they'd still be on an individual basis.